Hello? Hello? What? That was weird. Hello, and welcome to Call a Nurse with Nurse Veronica. In today's episode, we'll speak with a patient and provide some recommendations. We'll then walk through a sample NCLEX question on the same subject. Ready? Let's see who's calling in. Hello, you're on the air with Nurse Veronica.
Hello, Nurse Veronica. My name is Joan, and I'm actually calling about my husband.
I see. What can I answer for you?
I'm just worried about him. Lately, he's gotten more forgetful and his behavior has changed. He has some medications he takes every day and just can't seem to remember whether or not he's taken them. We've had to keep a calendar on our refrigerator just to make sure we're keeping track.
I see. Is there anything else you've noticed that's unusual or new?
Yes. He seems to be cold all the time. We have to keep the house extra warm to the point where I'm sweating, just so he can be comfortable. We took his temperature because I thought he might have a fever, but it was actually the opposite, just at 95.6 degrees Fahrenheit. We also took his blood pressure today, which was at 100/60, and his resting pulse is at 58 beats per minute.
Got it. Well, I would definitely recommend that you take him to a clinic or to his primary care physician. It sounds like you might want to run a few tests just to rule some things out. In either case, we'll want to get to the root cause. He could have an issue with his thyroid, for example. I would suggest setting up an appointment as soon as you can.
Okay, I'll call his doctor right now. Thank you, Nurse Veronica.
It's my pleasure. Wishing you all the best. Now that we've talked with the patient, let's take a look at a sample NCLEX question covering the same topic. In this question, answer choices 2 and 5 are correct. For answer choice 1, the client is conscious and alert, so reorienting doesn't apply at this time. In answer choice 2, the client has advanced hypothyroidism. The initial and least invasive treatment to prevent myxedema coma is oral T4 replacement therapy. Answer choice 3 is incorrect. IV hydrocortisone is administered when a client is unconscious or unable to swallow. This client is conscious. Answer choice 4 is also incorrect. A STAT 12 lead EKG is obtained immediately after acute cardiac changes or symptoms of acute coronary syndrome are identified, and then typically after pharmacologic treatment is initiated. Answer choice 5 is correct. The client is at risk for acute cardiopulmonary changes. The continuous monitoring captures acute changes in cardiac rhythm and oxygenation. Blood pressure can be monitored in time intervals, usually every 5 to 15 minutes, and provides real-time data for an emergent response. Thanks for joining me. If you have any questions, leave them in the comments below. See you in the next episode of Call a Nurse with Nurse Veronica.